Great. Thank you, Madam Chair. Well, it might come as no surprise I have a different opinion than my colleague, Mr. Aarons. But I always think it's very interesting. I mean, I just perused a bunch of University of California Health Center websites and all this great information, that's provided on contraceptives, HIV prevention, pregnancy testing, and then also medication abortion services all these other things. And then it's like referral for prenatal care. Am I like the only person in this room that thinks it's crazy that the University of California and other institutions and what we do in this building is focus on people who want to have an abortion? What about people who want to keep their babies? Like, I think we actually agree that there are a lot of expecting mothers who want and need help, and we should be helping them. And I think the UCs, honestly, it's shameful. All these health centers that exist that don't help these moms, these women that get pregnant on campus, and they have nowhere to go. And we will happily provide you with medication abortion, but hey, we will provide you with a referral to some clinician if you're lucky enough to have insurance to get it covered. I can't believe it. But that said, I have a question on the actual bill. I honestly want to know what this bill is solving, because right now you can call Planned Parenthood and get medication abortion sent directly to your doorstep. So, what gap is this? Why can't the community colleges or UCs or anybody else just give the phone number for Planned Parenthood?
Well, I've learned to pause when agitated, so I will let my witness answer that question.
Medication abortion can be handled through telemedicine. What we know about college students is that it's a new experience for them, being away from home, being on campus, and for them to be able to go to a student health center on campus that they've walked by will help them be able to navigate their questions, including, do they want to keep the pregnancy? Do they not want to keep the pregnancy? That's part of what happens in the UCs and CSUs now. There's pregnancy consultation with the students. For that student health center to then be able to call, if they don't have the medication on site, to be able to call another provider with the student is going to help that student tremendously. During the 4 years that I worked on SB 24, the parts that live with me are the students' stories and how the idea of trying to figure out where to go, how to get there, whether to take time off class, whether are they going to have to pay for it? They don't, because that's not readily available, is just really impossible for them. I mean, I had students in tears telling their stories to the team and to myself, and how I had a student who was a volunteer at Planned Parenthood, and she's at one of the UCs. She went to the student health center. They gave her a mimeograph page of abortion providers. One was a crisis pregnancy center. Another one wasn't doing abortions anymore. She was a volunteer at Planned Parenthood, and Planned Parenthood wasn't on the list. And so she thought because the student health center gave her the list that she couldn't go to them. The student health centers have to be able to meet the student, help them access the care, provide the care themselves, in order to let our students be able to stay in class, to stay learning, to stay growing.
Well, I appreciate your answer. I mean, Nothing stops the health centers from providing information or requiring them to do so, to provide the information to providers that have that, provide a referral just like they do for maternity services. But like, I'm just going to keep beating the drum. Look, I don't judge any woman who finds themselves in crisis and the decisions that they make. And I want to help every single woman that has an unplanned pregnancy. I think we have a major, major, major gap in this state for individuals that choose to keep their baby and find themselves in a situation where they don't know where to get help. I don't know if anybody even disagrees with me on that, but like, we need to do more, and I want to help them too. So thank you for answering the question.